South Sudan experienced unprecedented heavy rainfalls, which caused massive flooding during the second half of 2020. Besides, nearly 400,000 people have been displaced across the country due to flood emergency. This resulted in an increased risk of malaria, measles, respiratory and diarrheal diseases.
South Sudan is one of the really few countries that are prone to health-related emergencies and also outbreaks. And certainly one of the health emergencies that South Sudan is prone on is actually the flooding. In 2019 and 2020, South Sudan had really major floods that affected almost 2 million people.
Due to flooding, some sanitation facilities will be destroyed, and water sources also will be affected. When flood occurs, people are displaced. People are displaced, and because of the displacement, they face a lot of health problems.
To ensure uninterrupted access to healthcare services, WHO deploys emergency mobile medical teams to provide integrated mobile health services, capacity building for health workers, improve coordination and promptly respond to disease outbreaks.
We supported the response in Pibo and also in Bol, and that was really done through the establishment of the mobile medical teams that actually was put together and actually deployed there. So these are the teams that are mainly mobilized, and they constitute a number of experts. And these teams, you can have doctors, you can have lab technicians, you can have the public health people, nurses, and so forth. So they are put together to really respond and provide health services in places where really the service has been cut off.
A direct provision of services was really important for those people. And of course, you know, we know that it affected the health system in different ways. We know that some health facilities were damaged and so on. And through these mobile teams, they could go out into the community, find people who needed assistance, refer people who needed specialized care as well, whether for nutrition or even for, you know, sexual and gender-based violence. So it was very important then to be able to supplement the existing system with those mobile teams.
WHO emergency mobile medical teams were deployed to carry out joint medical outreaches to provide integrated life-saving health and nutrition services, including outpatient consultations, vaccination of children against common illnesses, community sensitization, nutrition screening and referral, and provision of medical supplies.
Bibor is classified among the 6 counties under severe food insecurity. And then this is also related to the fact that the county has been experiencing floods, and this has really affected the nutrition or the food safety or food security situation in the county.
We really appreciate the funding and support that came from the South Sudan humanitarian funds, and through this response, we really intend to develop a strategy that should be guiding not only WHO but also other partners in terms of response when flooding actually happens.
Since 2016, WHO has been providing critical life-saving primary healthcare services through the emergency mobile medical teams to meet the emergency health needs of vulnerable IDPs, returnees, and the host populations and communities cut off from routine healthcare services in flood-affected areas.